Good day, everyone. My name is Grace Ogala. I bring you good news from Amazing Grace Health Center. The topic of our discussion today is diabetes and oral health. Diabetes can cause complications in the mouth due to its nature. And this kind of complication is very common in people with uncontrolled diabetes. All right. Some of these complications include periodontal disease, that's gum disease, all right, and also tooth cavities, mouth abscess, gum abscess, dry mouth. These are not very pleasant, and that is why I keep on ringing the bell. Make sure your blood sugar is well controlled. Okay, before you eat, your blood sugar should be between 80 to 130. And also after you eat, maybe 2 hours after eating, it should not be more than 180, okay? But all of these numbers really depends on your state of health, and just seek the advice of your doctor to really know your target levels. But this is the right level that you should be, okay? Make sure your A1C is less than 7 to avoid this type of complications. So now let us take a look at the different types of disease that people can have in their mouths if they have uncontrolled diabetes, okay? The first one on the list here is the periodontal disease. And this results from bacterial infection that destroys the bone which surrounds and supports your teeth, okay? So that bone that is holding your teeth into the jawbone and ensures that you chew properly can be affected. If you have uncontrolled diabetes, leading to buildup of infection in the mouth, And let me just break it down a little bit. When you have uncontrolled diabetes, there's tendency that there is a lot of sugar in your mouth, okay? And the sugar in your mouth attracts bacteria. And these bacteria that come to the mouth, they are not good. They are out for trouble. And what they do is that they go and start destroying the gum. And if this bacteria destroy your gum, it's trouble, okay? And this kind of dental plague is just going to cause a lot of problems if you don't take quick action. And then you now see like gum irritations, you see swelling and you're bleeding. Like for instance, you are brushing your teeth and you see blood just pouring out anyhow. That's not good at all. It's not good. And all of these can make the bone holding your teeth to just go away like that. And before you know it, teeth will start falling off, or it will be extracted by the dentist or oral surgeon. That's not good. That almost affected me. It's God that saved me. So it's very real. And I really want you to make sure your blood sugar is well controlled so you don't end up with this periodontal disease. And usually when the dentist discover it on time, like in my case, mine was discovered on time, they put me through deep cleaning. And to God be the glory, they were able to clean out my tooth very well and to stop the progression of this disease. So, a stitch in time saves 9. And the next one is diabetes and tooth decay. All right. This type of tooth decay occurs when there is uncontrolled blood sugar, like I mentioned before. All right. There's too much sugar in the saliva, and there's then a buildup of plaque. And when this happens, it's trouble again, and the tooth start decaying. And before you know it, doctor will say, "Oh, cavity," and they end up pulling the tooth away. Okay, that's not good at all. Diabetes can be blamed for it too. It's more common in diabetics. It does not mean that it won't happen in people without diabetes. It does happen even if you don't have diabetes. But again, higher rates in people with diabetes. Okay, another common one that is we see among diabetes is these oral fungal infections. Okay, like thrush. You just see white patches and irritations in the mouth, and that's overgrowth of the yeast in the mouth. That's not good too. And when this happens, the doctor will end up prescribing medications for you to treat it quickly, and also advise you to have a very good blood sugar control. to prevent this type of a problem in your mouth. All right. I think one medication we prescribe is really nystatin. They have the one that is good. I know when I say nystatin, people are thinking it's the cream. It's not the cream. There is the one the oral use. There's even one swish and swallow or swish and spit out. The doctor can prescribe that for you. All right. But the whole thing that we have to take from here is please make sure your blood sugar is well controlled to prevent this type of complications. Okay. All right. So let's move on. Okay. When we have the following signs and symptoms, we should contact the dentist immediately. Like if you have bleeding, tender, red and swollen gums, hey, it's trouble. You need to contact your dentist immediately. And also if you have pus discharge from the gums, you should contact your dentist as well. Okay. Just know that maybe it's mouth access or gum access that is brewing there. And also if you have loose gums of which the tooth is pulled out, like look at your gum, you see that the tooth is coming out. That's trouble. You need to let your dentist know immediately. And if you have loose teeth, you touch your teeth, it's moving. Hey, that's not good at all. The teeth is supposed to be solid and firmly placed in the gum. It shouldn't be moving to any direction. So if you see anything out of the normal, contact your dentist. And if you have opening spaces between the teeth, that's trouble too. Too much space is not good between the teeth. I know some people say, I have a beautiful space. That's good. But if it's too much space, that's problem too. Just contact your dentist if you are not sure of what you see, okay, happening to your teeth. All right. If you have like bad taste in your mouth, hey, you're tasting things that is awful in your mouth, you need to contact your dentist as well. And also if you have bad breath, you brush your teeth well, you do this, you do everything right, and just keep on having bad breaths that is embarrassing you. When you open your mouth, it's like something else. You need to contact your dentist so that way they can take a look at your teeth very well, do x-rays and tell you what exactly is going on. Don't suffer in silence at all, please. And also, diabetics should do the following to decrease their oral complications, okay? Just listen and pay attention. The first thing that diabetics should do to prevent oral complication is make sure that blood sugar is within recommended limits. Like I discussed before, I mentioned your blood sugar should be 80 to 130 before you eat. And after you eat, 2 hours after you eat, it should be less than 180, okay? And you should do this by eating healthy, exercising, taking your medications as prescribed by your doctors. Pay special attention to your dental and oral health by keeping your teeth, your gum and mouth healthy. Okay, brush your teeth and gums gently at least twice daily. Okay, with a toothbrush and fluoride toothpaste. That was what saved my life. Hey, my doctor, God bless him forever. He was the one that told me in 2022, he said, my dear, use fluoride toothpaste. That will help you. And I took his advice, and since then, I've not put any tooth yet. Hey. So I'm advising you today, if you want to buy toothpaste, please buy the one that has fluoride in it. Okay? And also, you can use the battery-powered toothbrush also, if you have it in your country. And if not, you can use the regular toothbrush as well. Okay, brush at least twice a day when you wake up and before you sleep. And if you can brush in between maybe in the afternoon, that's fine too. And you also use mouthwash. There's a mouthwash that is very good, TheraBreath mouthwash, to rinse your mouth. All right. If you cannot brush your teeth, just rinse your mouth out, okay? So that way there will not be buildup of bacteria in your mouth, okay? That's very, very important. And if you live in a country that does not have mouthwash, maybe you can rinse out your mouth with salt and water maybe once a day. But also be very careful of that, so that way you don't go and start ingesting too much salt. That's not good for you, all right? But always contact your dentist for the best advice, okay? Also, deep cleaning can also be done at the dental office. especially if you have this periodontal disease. I think I mentioned it before. Okay, that one will be at the discretion of the dentist. Okay, I have done that as well. And to God be the glory, recently I did it on my birthday. I know when you all were celebrating my birthday with me, I was going through dental cleaning, the deep cleaning. It was quite painful though, but it was worth it because I just saw my doctor recently, and for the first time my doctor told me that my A1C was 4.9. I was so happy because ever since my A1C has been like 5.1, 5.2, and I've been eating very healthy. I don't know why it will not drop to 4 point something, despite everything I've been doing. You all know I've been declared diabetic free since 2021. But liver asks for more now. I still wanted to do better to break records. I wanted to have like A1C below 5. So I can tell you all about my story. And to God be the glory. After I did this deep cleaning to remove the bacteria build up for the, in my mouth, they said it was trying to progress to periodontal disease. My A1C dropped to 4.9. The reason I brought this up is for you to know the importance of dental care. All right, every little effort you make will decrease your blood sugar, will decrease your A1C, and help you to overcome diabetes. All right, this is a very important secret of overcoming diabetes. I know many of you will be saying, oh, I have done everything. I exercise, I eat healthy, I do everything you tell me to do, Dr. Ogala. I don't know why I cannot overcome diabetes. Oh, if that is your story, maybe you need to do what I just told you. Go and see the dentist and let the dentist take x-rays of your teeth, of your mouth, and tell you exactly what the problem is. And maybe when you do a deep cleaning like I did, maybe the A1C will just decrease. Who knows? And that's why we really advise that you see the dentist at least twice a year, okay, to get the best advice and get the right treatments. And also use dental flossing, okay? There's something you put in between your teeth. It's like a little floss, and you won't believe it. It was on my birthday that I learned how to use it. I know it's so embarrassing. The dentist was, oh, you just floss daily, floss one day. I say, hey, come here. I say, teach me what flossing is all about. I know you all will be so amazed that I didn't know it. And I learned it. I humbled myself, and she taught me, just put that floss in between each of your teeth, push it in, clean it out, and that's it. It was so simple. I was so excited. I said, this is my birthday gift too. And since then, I have been flossing my teeth once a day, and it has been very helpful. It removes everything. What I was using before is the toothpick, and the toothpick is not so good. The toothpick did not really help as much as the flossing thing helps, So I really encourage you, if you have floss and wherever you live, go get it, okay, and use it, all right? And it will really help you to decrease your risk of cavity and periodontal disease. And also drink plenty of water because when you drink plenty of water, it will help to hydrate your mouth. All right, because this bacterial buildup is caused by decreased saliva. When there's decreased saliva in the mouth, you don't have water that is flushing things out in your mouth. It may even increase the buildup of bacteria. That's not good for you, and it causes this dry mouth. It's not good. So drink adequate water. Half of your body weight is what you use in knowing the amount of water to drink. For instance, if you are 200 pounds, you should drink at least 100 ounces of water. That's like 6 bottles of the 16-ounce water bottle. That's your minimum, though. You can drink more than that, all right? And drink adequate amount of water if you don't have heart failure or kidney disease. But always check with your doctor to know how much water you should drink daily, okay? And also do not smoke. Because if you smoke, it will increase your problem. Smoking is not good at all for you to maintain oral health, okay? And make sure you do the needful. Lose weight, about 7 to 10% of your body weight to overcome diabetes, maintain a healthy weight, okay? And eat healthy, half of your plate fruits and vegetables, quarter of the plate carbohydrate, quarter of the plate protein. Exercise at least 30 minutes daily. All right, don't forget about the muscle building. Just lift weights, okay? That helps with decreasing insulin resistance. Take a walk, brisk walking, jogging. Different kinds of exercise is very good for you, okay? Try to drink water, a lot of water, to flush away the excessive blood sugar in your body. All right, and stress management, don't forget that. Manage your stress so that way your hormones will not cause increased blood sugar. All right, and sleep adequately. 6 to 8 hours of sleep is important. All right, and do the needful. Continue to do your best, and don't forget to take your medications. Go to your dental appointments, okay? Regularly go to your doctor's visit as well. Also, don't forget about food care. That was what we studied last week. All right. Examine your feet every day. Apply lotion to your feet, not between your toes or toe. Don't do that. Just apply lotion after cleaning up your feet, and trim very well. Take care of your feet. And if you see any issues with your feet, always let the doctor know. Don't wear tight shoes. Just take care of your leg very well, okay? And I pray that God will heal us from diabetes perfectly and permanently in Jesus' name. Please follow me on all social media outlets. Let me know if you have any question. All right, contact me. I will try to answer all your questions, okay? God bless you. I really appreciate you so much. All right, see you all next week again. And please share my video. I love you all. Thank you.